Assalamualaikum warahmatullahi wabarakatuh. My name is Nora Adana Azmi, and now I will explain about the PACEMAN for the AP forearm projections. As you can see here, this is the radiograph of the AP projections of the forearm. It's evident by distal ulna and radius are not superimposed, which is if they are superimposed, it will become lateral projections. For the positioning, this styloid is demonstrated in profile laterally, while radial tuberosity is demonstrated in profile medially. Radius and ulna, it is parallel. And the last one, for the rotations, how we detect the rotations. So as you can see here, the wrist is internally rotations and the elbow is externally rotated. It's evident by, as you can see, less than 0.6 cm superimpositions of the radial head and radial tuberosity with ulna. The standard centrum point for this projection is at the mid forearm. That's for the collimations. At the superior border, the structure must be include wrist and 1/3 of hand. At the inferior border, the structure should be include is elbow. And for the lateral border, structure that should be included is lateral skin margin. There's no presence of the radiation protection apparatus seen on the radiograph. Exposure factor. The KVP used is adequate for penetrations and radiographic contrast. Is evident by the bony cortical outline of the thick structure, which is distal ulna, and the bony cortical outline for the thin structure, which is diaphysis of the radius, is clearly visualized. And also for the MAS, is adequate for the detail and density, evident by bony trabecular pattern for the thick structure, which is distal ulna, and the bony trabecular pattern for the thin structure, which is diaphysis of the radius, is clearly visualized. Thus, no change for the KVP and MAS. For the marker, there is presence of the anatomical markers seen on the radiograph. The L marker is placed on the left side of the forearm. Thus, the marker placement or positions is correct. Next, for the aesthetic, the film size used for these projections is 24 x 30 cm, which is suitable to demonstrate all the structure of interest. And the last one, for the name, patient name and ID, date of examinations, and place of the examination not present on the radiograph. It should be placed at the edge of the inferior border of the film or cassette.